Hi, my name is Ilya Sofia binti Muhammad. I will present to you about the case study of COVID-19 report. The purpose of this case definition is to give a factual and accurate information. Hence, we also aim to lessen people's fear and perception about COVID-19 diseases and help them to have a clear and actionable guidance to control the COVID-19 outbreak. In March 2020, Ministry of Health Malaysia has distributed some infographic to divide people into 4 categories, as each of them plays important role in detecting and reducing COVID-19 outbreak. The 4 categories of people consist of categories A, B, C, and D. Category A is the first carrier and they are easy to find and mostly in care. A go out to find C, passed by stranger, B in public, A and B don't know each other. However, the problem is we can't find B, nobody knows who is B including the B themselves. A arrive and contact with C, no matter how many C we can always find them. C will be quarantined and observed. In contrast, D stays in home and never goes out, but once D goes out, she might pass by B. Now, D will become the new B, which is B2.
PUI refer to a person who had been in close contact with a person with confirmed infection or and may have been to a place where there is an outbreak of COVID-19 case. Experiencing an acute respiratory infection or onset of at least one symptom with or without fever, travel or stay overseas 14 days before symptom onset, be in close contact with a positive coronavirus case 14 days before symptom onset, attended a gathering or program linked to a COVID-19 cluster. Each individual responsible to follow the standard of practice in cases of patient under investigation PUI of COVID-19. Follow the standard and know you are in which categories, low, moderate or high risk.
The suspected COVID-19 cases is divided into 2, epidemiological criteria and clinical criteria. The clinical criteria includes the presence of high fever, sore throat, cough, shortness of breath and headache, while epidemiological criteria is attended an event that have a COVID-19 cluster, live or have been in red zone cases and travel to or from any foreign countries.
The following is the symptoms of probable COVID-19 case. A patient who meets clinical criteria and a contact of probable or confirmed case or epidemiologically linked to a cluster with at least one confirmed case. A suspect case with chest imaging showing findings suggestive of COVID-19 disease. Below are typical chest imaging. A person with recent onset of anosmia or ageusia in the absence of any other identified cause. Death or in adult with respiratory distress preceding death and was a contact of probable or confirmed case or epidemiologically linked to a cluster with at least one confirmed case. A person with RTK-AG positive awaiting for RT-PCR confirmation.
Now, we will take a look at the symptoms of COVID-19. There are 3 types of symptoms: less common, most common, and serious symptoms. There are 7 less common symptoms, which are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of smell or taste, and a rash on skin. For the most common symptoms, there are fever, dry cough, and tiredness. And for the serious symptoms, there are difficulty in breathing or shortness of breath, chest pain or pressure, and lost the ability to talk. It usually takes 4 to 5 days that symptoms to show when someone is infected to the virus. However, it also can take up to 14 days. People with the mild symptoms but still healthy are advised to stay at home and self-quarantine. Seek medical attention immediately when you have the serious symptoms. Thank you. So, how the COVID-19 been detected? There are 2 types of tests to detect the COVID-19. The first one is the molecular test. It is nucleic acid detection, which it diagnoses active virus infection. In this test, the first step is to obtain a nasopharyngeal specimen by the swab test. The second step is extract RNA from the specimen and convert to DNA. The third step is amplified by PCR with the severe acute respiratory syndrome coronavirus 2 specific primers. For the fourth step, interpret the result. If there any presence of the viral RNA indicates active SARS-CoV-2 infection. For the second test, it is antibody test, which is it detects immune response to the SARS-CoV-2 exposure. For the first step, obtain a specimen from the blood sample. For the second step, expose specimen to the SARS-CoV-2 specific antigens. And the last step, interpret the result where the color changes indicate previous exposure to the SARS-CoV-2.
PUS refer to patients who do not meet the criteria. After examined by doctor, will receive home assessment tools, age 18. A symptomatic individual subjected to home civilian order. Always be at home and contactable at all times. Limit your visitors. List out those who visit you. Wear face mask. Cover your nose and mouth with tissue whenever coughing and sneezing. Dispose the used tissue into the bin. Wash your hands frequently with water and soap or use hand sanitizer. Avoid sharing eating utensils and personal care equipment. Limit your distance at least 1 meter from others. Keep the windows open for good ventilation. If you need to leave your house, wear a face mask. Avoid crowded places. Avoid using public transport.